News this morning on this new weight loss jab, Hilary. It's going to be rolled out apparently in the next year by the NHS, but it could take a while for everybody to get access to it.
Absolutely. Look, there are 3.4 million people who are severely overweight in this country or obese. And if they all turned up at the clinics tomorrow, the NHS would be overwhelmed. There simply aren't enough staff, not enough resources to say, right, this is a specialist clinic, we need to look at what you're eating, we need to look at the amount of exercise you're taking, we need to get the right dose of this medication, we need to follow it up and monitor it for any side effects which can happen. Simply, we don't have enough staff or resources to look after everybody all at once. So what NICE are saying is that they are going to make this available for around 250,000 people, about 220,000 people who are already in these clinics, have already been referred, or who have the most urgent and most pressing clinical needs. So they're grossly overweight, they've got other conditions that are related to their weight. So that's going to happen in the next 3 years. Other people will be waiting up to 12 years. And I know that sounds...
12 years?
Yeah, to see everybody. But, you know, it is about resources. There are people with other conditions that would otherwise be detrimentally affected, people with strokes, people with cancer, people with Alzheimer's.
We can't have that.
And we've got to ration it, if you like.
No, that's true. It's interesting, though, because sometimes, you know, just losing the weight isn't enough. It's about talking to people as well, because the relationship with food is skewed. You know, that's the thing. And if you don't get that, and they're just going to eat again and get
It's got to be behavioural, there's got to be lifestyle changes, and of course people will still be able to go privately, which is actually unfair to everybody who can't afford it. And as I say, there are side effects and it's not appropriate for everybody. So counselling, wisdom, knowledge is key.
Absolutely. OK, now, antidepressants also making headlines this morning. Lady Gabriella Kingston said that her husband Thomas, this is so tragic, took his own life after an adverse reaction to medication for depression. And Amir, we know that there can be side effects with these tablets. We're not sure of all of the details in that case, but it's absolutely tragic. But for goodness sake, anybody who's on medication should not stop immediately. That is not, you know, if they may be a bit frightened by these headlines.
Yeah, morning. It is tragic, and you're absolutely right. There'll be lots of people watching this right now who are on antidepressants and they're working for them, they're quite rightly prescribed for them. You should continue taking them as prescribed. Antidepressants are really important medications to treat complex conditions like depression, anxiety, obsessive compulsive disorder, but they treat symptoms rather than the underlying cause. So they're often given in conjunction with things like talking therapy and lifestyle changes such as exercise, sleep and nutritious food, which we know helps mood as well. Now, when we are starting people on antidepressants, particularly the newer ones that we tend to use called selective serotonin reuptake inhibitors, what we have to do a degree of counselling with the patient before we begin them, because as you say, there are potential side effects. Nobody is likely to feel any benefit to their mood in the first 4 to 6 weeks of starting them. And in fact, for the first 2 or 3 weeks, you can feel worse rather than better. So it's really important that there's a lot of safety net going on, and we have a follow-up appointment with you in the first couple of weeks to see how you're getting on. I often give antidepressants if I am prescribing them for a patient, with numbers for emergency mental health services and our emergency number here at the surgery, in case you do feel worse, you get dark thoughts and you need to ring someone for help. The people most at risk of those kind of side effects are people under 25. And we don't like to mix antidepressants either. Taking more than one different type of antidepressant increases the risk of side effects without getting the benefits. There are other side effects as well. You can get indigestion, nausea, vomiting, headache, loss of libido. So those are important to counsel people about, but they are good drugs for people who need them and they're effective. So if you are using them and they're working for you, please do continue to take them.
No, absolutely. It's that thing, Hilary, if you want to come off this, you don't just stop.
No.
You know, you've got to do it gradually if that's the way that you want to go.
Absolutely, because otherwise there can be rebound withdrawal symptoms. Now, we've heard Roman Kemp talk recently about him coming off his antidepressants gradually. He's been on them a long time, so he needs to taper off the dose very gradually, probably over a period of months, because he's been on them for so long rather than just weeks or days. And there may be side effects. There can be a return to suicidal ideation when you come off antidepressants. So it needs to be monitored as well when you taper off the dose, and you do that with the advice of your healthcare professional. So I think that's really important to know. And there can be some side effects when you come off to start with. There can be headaches, dizziness, feeling of indigestion, nausea. These things aren't uncommon. But great if you're coming off, but you need the support. You need the cognitive behavioural therapy, the counselling. You need to understand why you were depressed in the first place and put everything in place so that you're supported in other ways if you want to come off your antidepressants.
Absolutely. And if you are feeling a bit, you know, maybe Amir, if you are feeling a bit anxious, depressed, upset, because this is supposed to be an amazing time of year, and it is, but for an awful lot of people, you know, Christmas kind of brings up feelings of loneliness, isolation, all of these things. When should you seek help? Because we're terrible, some of us, at just bottling it all up.
Yeah, definitely. If your mood is affecting your day-to-day activities, whether it's anxiety, whether it's low mood, if it's affecting your sleep, your appetite, your interactions with other people, and it's persistent, then you must speak to your doctor. And if you can't get through to your doctor, there are the Samaritans. If you've had very dark thoughts, particularly about thoughts about harming yourself or other people, you must call either 999, speak to an emergency mental health professional in your area, or tell the receptionist at your GP surgery, this is how I'm feeling, I need to speak to someone today.
No, exactly. And that's a priority, isn't it, Hilary? You would be put for that. The difference, though, between, you know, stress that I think most people suffer from, and then when it becomes much more serious and moves into anxiety and depression.
It's a good question. And people use the terms, you know, synonymously, don't they?
Do.
But actually they're different. So stress is sometimes a positive thing. Stress can give us a challenge. We rise to it. We're stimulated. We perform better with a little bit of stress. But too much stress can become overwhelming. And we can't sleep and we get anxious. And anxious, to me, always conjures up the idea of something that's very uncomfortable. So psychologically and physically, we feel the effects of anxiety. For example, butterflies in our stomach, nausea, panic, sweating. These things are pretty intolerable. Physical symptoms as well as psychological, you know. So anxiety and stress are stress can be managed, you know. It's about delegating some of the work to others. It's about taking time out for yourself. We'll talk more about that in a minute, the lead up to Christmas. But anxiety is a horrible thing. And it's about finding out what's causing the anxiety, making sure you identify the causes and dealing with them in priority. What's the worst thing? Let's deal with that. Let's get that under control, and then the rest can follow. So,
Amir, you are always very wise about how we can avoid things like stress. Sometimes you can't. Sometimes you can't. You're going to be stressed out about an exam, or you're going to be stressed out about your driving test, or something like that. Or even a lot of people are stressed about the upcoming Christmas day. You know, but what would be your advice that everybody could do right now?
Yeah, so it is a stressful time of year. There's lots of things going on. And particularly if you've volunteered yourself to do the big Christmas dinner on Christmas Day, you could feel the pressure. So here are my top tips to feeling less stressed in the run-up to Christmas. So number one is definitely plan ahead. There's a lot going on right now. There's busy shops, lots of traffic. If you've got lots of kids in the family like we have, you've got about 3 nativity plays to attend. So make a list, check it twice, prioritise what you need to. That way you don't forget anything and there's no last-minute panics. Number two, put yourself first. It's the season for giving, and that includes giving to yourself. If you want to be productive, you've got to look after yourself. So make sure you're exercising right, you're sleeping right, and you're meeting your friends for a bit of a good time every now and again as well. The third one is super important. Check in on your finances. It's such an expensive time of year. Expenses mount up. You can end up spending more than you can afford. And nobody needs so many pajamas, so many scarves and hats. You don't have to spend your money on that. My advice, and this is what you, Lorraine and Hills, are getting for Christmas from me, batch make some cookies. I do this every year. Batch make some cookies, wrap them up in some nice tissue paper and a ribbon. That's a much better Christmas gift. It gets eaten and less waste, better for the planet. Remember to set your boundaries as well. Your boss might ask you to do an extra shift. You might get asked to go to a Christmas do that you just don't want to go to. Say no. Save your time for these other things that you've got to do. And ask for help. If you're doing that Christmas dinner, I know you want to do it all yourself and you want it to be perfect. But people don't mind helping. Ask them to make the roasties. Ask them to do the dessert. And if you've done the vast majority of the cooking, make sure someone else does the cleaning and washing up. And I think the most imperfect, perfect Christmases are the best ones when it comes to families and friends.
Oh,
I'm going to his place at Christmas Day.
Oh, I would love Mama Can's
I'll get a jersey like that.
Oh, fantastic. Thank you. Everybody's getting penguins from me this year.
Penguins?
You can get penguins from the Falklands and give them to people. You don't actually get the penguin at your door. It is there in the Falklands, but you can name it after. They've got one for Billy. Right, you can find help and support on our website as well, of course.
Looking for more health and wellness content? Well, there's plenty more really useful information right here on our channel. How about you check out this one?